Hi, and welcome back. Today, I want to go over the intake process. Now, this can be a little bit different for everybody, but generally speaking, it has the same concept. So, the intake is the first session that you have with your therapist. Now, technically, for some people, they could say that the intake begins when you first call somewhere and you fill out the paperwork and there's informed consent and you're going over how much a session is going to cost and all of those things. That might be true, but I'm talking about when you actually show up for your first session and sit down with the therapist. What is that? So typically what that is called the intake session. That looks different than all your other sessions because all your other sessions, they're not so structured and formatted. They're kind of like, hey, this is what's going on in my week. These are the topics that I want to process. And it's more of a free-flowing conversation. Intake is specifically arranged in a way to gather as much information as possible so that you can get a good understanding of what is going on and why somebody's coming to therapy. This video can be helpful for anybody that is a therapist and you're just starting out new in an agency and you're like, how is this going to go? So you can kind of get some information and a preview on what you're going to be asking. Vice versa, if you're somebody who is looking into therapy, it gives you a preview of what you should expect on your first session. Okay, so generally speaking, this is how I do my intake. Now, granted, it might be a little bit different for everybody. Like I mentioned, you might not have all of the same exact questions or it might not be as structured, but this is the information that a therapist is looking for when they first meet with somebody. How it starts is giving background to the presenting problem. Basically, why did you come to therapy? What brought you here? For different people, this is different reasons. So it could be somebody's experiencing anxiety, somebody is experiencing depression, somebody just lost somebody and they're grieving, somebody is in a manic stage for the first time and realizing that they have bipolar disorder. So really it depends, and that's why it's important to know what brought you here. So the question might be presented as literally what brought you to therapy. The other question might be, let's talk about the presenting problem. What is happening right now that is causing an issue in life that you would like to address? Once you've done all that, there's usually another topic, which would be risk assessment. We always want to make sure we're assessing for safety. Risk assessments usually ask questions about suicidal ideations, self-harm, attempts, thoughts, things like that. Now, sometimes when people hear that, they think, oh, wow, that got really deep. What does the therapist think about me that they feel like they need to ask a question like this? But it's not personal at all. It is literally what every therapist is supposed to do when they're meeting somebody, because you want to have a background of this information to know, like, is there anything that we need to address immediately? Are there safety concerns? And if there are, how are we going to work together to fix this? Because we want to make sure when it comes to safety, that's a priority. So for the therapist, don't feel awkward to ask those questions. And as a client, don't feel uncomfortable if somebody is asking them, because we want to make sure that we are taking care of safety. Now, for some people, it can look differently. Some people might say, you know what, I think about it, but I don't really have a plan. I'm not going to follow through on anything. It's just, yeah, sometimes I think to myself, like, what if I wasn't here? You want to be able to express what you're thinking and how you're feeling so that there's a good understanding of the level of risk. So if somebody's saying like, yes, I actually have a plan, X, Y, and Z. Okay, now we know we need to create a safety plan. If somebody says, well, it's something that I've thought about, but I'm not going to do anything with it, we could say, okay, let's talk more about that. Like, why are those thoughts coming up? What are the feelings that that's bringing up for you? Very important to be open and honest in this section, because ultimately you want somebody to be able to understand what is going on, because if we don't understand, we can't address it. There's usually some form of identification section. This is where somebody could say, I am a 41-year-old non-binary African-American Christian. I don't know, that was random, but either way, it's how you identify yourself. And the reason that this is important is because it also gives insight to, how does this person view themselves? How do you view yourself? If somebody asked you, who are you? How do you describe yourself? Do you talk about age? Do you talk about religion, spirituality? Do you talk about your ethnicity, your background? Like, what is it that you identify as? Because that's going to give insight to what is important to you. What you identify as is important because that shows how you view yourself. How do you look at yourself? So I wouldn't say it's the most important thing in the intake, but it does give insight. And so however you describe yourself, take time, think about it. Then we usually have a section for the history of the presenting problem. So if you remember, we talked about the presenting problem. Let's say it's up here, and it's one of the first things to talk about, what brought you to therapy. Now we want to talk about the history, because if you say, oh, I'm coming to therapy because I want to address my anxiety. Okay, that's good to know. You have anxiety. That is very good to know. However, we also want to know what is the history, because we could probably find a root cause there. A stem, like where is this stemming from? And that's important, because if we want to decrease the anxiety, we need to know where it's coming from so that we can address it. So the history is just as important as the presenting problem and where you're at right now. So you're going to go into depth with that. There's usually a section for substance use. This is not to shame anybody. Sometimes it seems like people get awkward with it. It's not judgmental. People socialize and have drinks. It's not to say, oh my God, you should never have any drinks. You should never go out and party. It's not about that. What it's about is, well, assessing for safety again. And also, what is your lifestyle like and how is it impacting how you feel? Because if somebody says, well, yeah, I'm drinking every single day. I come home, I'm stressed out, and I just want to have a drink. It helps me relax. Or if somebody says, oh, well, yeah, I smoke weed every day because I just want to relax. That is indicators of there is a feeling that you don't like feeling, and so you are masking it with this other thing. If somebody just comes in and says, yeah, sometimes I have some drinks, I go out to dinner, I have girls' night, whatever, that's normal, right? So again, it's not to be like, oh, you drink, what's going on with you? No, it's just about what is your lifestyle like, and is it impacting your mental health? Also, because in some situations, substance use, certain drugs, they can induce psychosis. So sometimes if somebody comes to you and says, well, I've been seeing things and I've been hearing things that aren't there, and sometimes it could be linked to substance use. So that's another important factor, because again, we want to know where this is coming from. So there's a lot of things that can come from this section, so it's not personal. Answer it as honestly as you feel comfortable, and then it'll help give the background story. Also with background story, there's usually a section for family history. The reason that this is important is because our family or caregiver, whoever was there that raised you, usually they have a lot of influence over who you are and how you see the world. When we're little kids, we look at our caregivers, our parents, the people that are always there to kind of show us, how do you deal with things? What is it like? And so you'll see sometimes when people come to therapy, they'll say, oh, well, I have anxiety and my dad has anxiety. And when I was little, I would be confused as to why he was so on edge or why he would act out sometimes. And then you're realizing that you're taking on those same traits. And it's probably because when you were little, you learned this is how you deal with feeling on edge. You act out, and your brain absorbed that either consciously or subconsciously. And it becomes a part of you. And that's important to know, because we know there are generational patterns. There are a lot of things that get passed down. And so again, it's about understanding the root. Where did this come from? And it doesn't have to just be anxiety. It could literally be anything. We also find that there is sometimes a genetic link. So it could just run in the family genetically. It doesn't have to be because you saw somebody do something a certain way. So try to be open with that as much as you know. Sometimes I have people that say, like, I honestly don't know. I'm not close to my family, or I only know a couple of people in my family, so I can't tell you for sure. That's okay. The intake, there's no right or wrong answer. You do the best that you can with answering, and that's all that you could do. You can't force yourself to have knowledge that you don't have. There's usually a section for spiritual and cultural factors. This kind of is similar to identification, but it's important because obviously different cultures have different norms, and we want to make sure that we acknowledge those when we're talking to people, because what might be a cultural norm for me might not be a cultural norm for you. A good example that they used to use in school when I was learning is if you get a client that doesn't make eye contact. In some cultures, it is disrespectful to make eye contact. You're supposed to look down and show respect that way. So if you get a client who you're noticing is always looking down, is it that they aren't listening, or is it that they're being respectful? Because in other cultures, if you're looking down and you're talking like this, the person might be like, hey, look at me when you talk to me. Because to them, they think that that's what respect is. Respect is you make eye contact. That's not for everybody. So we want to take cultural factors into consideration. We want to talk about what's important to them. Like, what are their traditions? What makes them who they are? Because that's important as well. There is usually a section for educational and vocational history. And that's just kind of like what it says. What is your background in? What do you do for work? That can lead to a lot of other conversations. Are you passionate about what you do for work? Are you happy with what you do for work? Because sometimes people will be like, I'm spending so much time at my job and I hate my job. Well, if you have depression and you hate your job, I'm sure that's impacting it. You're spending a lot of time at work. So we want to make sure that we kind of cover all bases. Obviously, you're never going to know in 60 minutes everything about somebody's life. So I'm not saying that because you get this information, you're just going to understand everything and have all of the solutions. That's not the case. But you're going to have a better understanding of who this person is. Another very important factor that is talked about in the intake is trauma history. And the reason that this is important is because if there is trauma, a lot of times that is stemming from the current, or that is the stem to the current situation now. We don't want to overlook trauma. Sometimes people say, oh, well, that happened 10 years ago, so why am I going to talk about it now? Odds are, if you have not talked about it and you haven't processed it, it is showing up in your life in different ways, maybe ways that you're not even realizing. It is uncomfortable at times to talk about trauma. So what I say to people that don't feel comfortable talking about it, just acknowledge it. Yes, I have a history with some trauma. I don't feel comfortable talking about it. And for the therapist, you shouldn't take it personal. If it's your first time meeting me, I don't expect you to tell me every last thing that is personal because you don't know me. I need to earn your trust. Vice versa, if you're a client, you should not feel pressured to say everything if you're not comfortable and you're not ready. It takes time to build rapport. Give whatever you feel comfortable with, but if nothing else, just acknowledge, yes, it's there, but I don't feel comfortable talking about it right now. This way the therapist knows as we build rapport, this is something we could circle back to and check in on. There's usually a section for any medical history or current medications. This is important because sometimes our physical health or medical conditions will impact our mental health. We want to make sure that we are assessing everything that's going on. We also want to be aware of current medications for a couple of reasons. Number one, if you're seeing a psychiatrist, like I don't prescribe medication. So if you're seeing a psychiatrist and you say, oh, I'm on such and such medication, it's going to give me an idea of, okay, this is what you're being treated for. This is a possible diagnosis. So just the first thing that comes to my mind, if somebody says, oh, I'm on Ritalin or Adderall. Okay, this person is diagnosed with ADHD. This is something for me to consider. It could be for anything. It could be medication, an antidepressant. It could be for anxiety. It could be for psychosis, any of it. The point is we just want to know so that we can say, okay, let me make sure I continue treating you for this, because it's not going to be helpful if the psychiatrist is treating you for one thing and the therapist is treating you for something else. We want to be consistent and we want to bring our services together as much as possible. There is usually a section for social history. This is just kind of going back to like what lifestyle that you have that contributes to whatever's bringing you to therapy. So sometimes people will say, I feel really isolated. I don't have a lot of friends, or somebody might say I moved from Connecticut to California and I feel like I just haven't made friends yet. I feel very lonely. Okay, so if you're struggling with depression, there is a possibility that you are going to feel more isolated or feel those symptoms even further because of the depression. And that's important to recognize and be able to say. The other thing that you could be asked about is developmental history. This one is kind of interesting because a lot of times people will say, oh, I don't know about my milestones if I met them, things like that. The reason that it's asked is also because, or not also, but the reason that it's asked is because we're trying to get an understanding of if there are any developmental delays or educational delays or any delays or disabilities that are going to impact mental health and the symptoms. Beyond that, we usually have a legal history section, which could be anything about probation, getting a DUI, but anything, right? And that's kind of important because, well, sometimes people are mandated to go to therapy because of something that they got arrested for. In that case, if they're not very happy about coming to therapy, they're probably not going to want to engage that much. It's good for the therapist to know it's okay if you actually put it on the table, like, hey, I didn't want to be here anyways. If somebody says that they've been arrested for 3 DUIs, then obviously you're going to start to ask questions about their lifestyle and drinking and things like that. There's usually a bottom section that is for strengths and needs. So what are your strengths? How are you going to use your strengths to make changes and better your life or be successful within therapy? And then what are your needs so that we can put it on the table? What needs to happen to make you feel better? Usually the needs is what helps you create the treatment goals. Treatment goals are specific towards the person, so they're not always the same, but somebody might say, I want to work on decreasing my anxiety, I want to work on decreasing my depression, I want to work on increasing my patience, I want to work on increasing my communication skills so they're more appropriate, so I'm not yelling and screaming whenever I get mad and become reactive. They can look very different. Generally speaking, the intake, like I said, is not always the same, but it serves the same purpose no matter what. A lot of places, it's about an hour to get all of the information. Some places, I think their sessions are anywhere from 45 minutes to an hour. So you might get 45 minutes at my current private practice or group practice that I'm in. It's 53 minutes as a session. At my part-time group private practice, it is 45 minutes. So that varies as well. It's not always the same, but ultimately you have around an hour to get this information. If there's anything that you forget to ask, you can always ask it in the next session. And if you're a client and there's anything that you forget to say, you can always say it in the next session. There's always another session. There's always another availability. Not everything has to be completed in one session. So I hope that was helpful. I think sometimes having the insight is important because you want to know, like, what should I expect? And a lot of times you can kind of expect the same thing because it operates similarly. If you have any questions, feel free to put it in the comments. I could make further videos or more explanations as to why we do the things that we do. Moving forward, I'm going to work on some other videos about, like, what do we do with these symptoms? What are some interventions? What does therapy look like after the intake? So I'll probably also do a video about treatment planning. So just let me know what you want to see. I want to be helpful. And yeah, that's it. So thank you for your time. And I'll see you in the next video.